Alrighty, good morning, everybody, and welcome to our first HAI task force meeting since the COVID pandemic. I'm happy to see so many people join on. This is officially the largest meeting that we've ever had um, since the start of the group, so we're off to a great start. My name is Kamisha Kazi. I'm the HAI coordinator. You've probably seen my name on memos that have come out, emails. So now you can put a face to the name. I work here in Las Vegas. We have staff for the HAI program in Vegas and in Reno. So they're on the call as well. So just wanted to welcome everybody. I have the agenda posted for today. Traditionally, this meeting follows open meeting laws. But with this being our first call, they won't be followed today. But our meetings moving forward will follow the format of our open meeting laws for the state of Nevada. So normally there would be a roll call, but there's so many people, and now we have the use of Teams. With recording the meeting, we can utilize a transcript to get a roll call. For those who called in, you will receive a text message asking you for your name, your email, and for your facility name so that we can have a count of you as well. We do have a link. Cece, if you could go ahead and add that to the chat because we do need to update our distribution list, which of course, with staff turnover, probably is not very accurate at this point. So the link is in the chat, and for those of you who called in, the link will be emailed to you. This form will ask for your name, your email address, your facility type, facility name, and then I will mention about the voting members and the subcommittees later on in the call. So there's a spot on the form if you want to be a voting member or want to nominate somebody to be a voting member for you to enter your information or their information. Um, Please also, you can forward this form to others who are not on the call and want to participate in the meeting. We had a lot of invites. Well, the invite for this meeting was forwarded to several people that weren't included on the initial list that we sent out. So if you forwarded this meeting on to others, please send the link to them so that we can have them on our distribution list for the next meeting. So our next item after my introduction, Cece and Christine, if you could come off mute and introduce yourselves. Cece is my right hand with the HAI program. She serves as a health program specialist, and Christina Emmons is our new AR coordinator. She joined the state last Monday on the 24th. Was her first day with us. So if you two could come off of mute and introduce yourselves, and then we will move forward with the agenda for today.
All right. Hi, everyone. My name is Chidima Najoko. I go by CC. I'm the health program specialist for the HAI AR program.
Hi, my name is Christine Emmons. I am also working on the AR program. So,
Christine is new, but she comes with a great background in laboratory and research. So to help um, move our AR program in the right direction. So we will move on to the purpose of the HAI task force. So I mentioned some of it in the meeting invite, but just to give you a quick summary, we began this group in 2016. It was a small group of infection preventionists, representation from the Division of Public and Behavioral Health with our state epidemiologists along with HAI staff, representation from our local health authorities or LHAs, and our state QIO, which at that time was Health Insights, but has been renamed to Comagin Health. Um, and this team, we met, I believe, quarterly, and we worked to develop our first state HAI plan, which utilized a template that CDC provided. And we went through that template and just developed measures that Nevada would work to meet in order to decrease HAIs and the spread of MDROs in the state. We also develop training material, webinars. So we utilize this group to get access to speakers. You all are on the boots on the ground. You know who all is out in the community. So for the specific topics that we wanted to teach on or that were highlighted as topics of interest from healthcare professionals. We utilize this group to identify um, speakers for those topics and develop webinars, or we have our large in-person training that we haven't held since COVID hit, where we hold, it's one meeting in two locations. So we connect utilizing video conferencing technology through the University of, what even our University of Nevada, Reno. And it also connects to our rural hospitals so that they can join as well. And we have presenters in both locations. It's a full day thing. We provide breakfast and lunch. Um, and so this group was also utilized to, oh, they're saying the volume is low. I don't know, maybe I can move closer to the computer. Hopefully that helps. I don't think increasing my volume does anything. I'll try it.
Kamisha, I can hear you pretty well, so I'm wondering if maybe are others having issues, or maybe it's the person can turn up their volume.
I can hear you well as well, Kamisha.
Okay.
I'm not having a problem either.
Okie dokie. So we
Same.
will carry on.
I'm thinking people need to turn up their own volume on their devices.
And if the computer isn't working, we also have the call-in information, so maybe your phone volume will work better. Seems like the volume is okay for most. So yes, so that was what the group was utilized for. We also developed our antibiotic stop sign that was distributed to acute care hospitals for their waiting rooms to help educate patients on when antibiotics are appropriate and when they're not. Um, so those are some of the projects and activities we did with this group until COVID hit. So once COVID hit, we did not have any more meetings. So this is the first one. As I mentioned, this group does follow open meeting laws, so we have to have voting members, which also have a representation through their proxies. We do have to meet quorum, which is 50% plus one, in order to hold a meeting. So if we don't meet quorum, based on open meeting laws, we're unable to hold the meeting, and we would have to cancel and reschedule. We do have to have a meeting agenda, which I have posted. Um, Meeting minutes are something that we have to have, as also as our meeting information has to be posted in an appropriate time frame. So normally, following open meeting laws, you would see the agenda in our previous meeting minutes posted in different locations throughout the state, which the agenda would show where these locations are posted. So that's some of the things that you all will see for the next meeting. Somebody in the meeting muted me. Um, so I put the bylaws in the invite yesterday just so that you can review them and see what they look like. So one thing that we will need to do is reestablish our voting members. And once those are reestablished, then we can go through the bylaws to keep things from being confusing and having so many opinions. The voting members or the subcommittee will review the bylaws, do the edits on those, and then we will present it to the entire group. And allow people to make edits that way. It would be emailed out, and then those edits would be sent in and compiled, and then the final edit would be presented to the group, and then finally the voting members would vote to approve those bylaws, which all of that information will be posted on our HAI webpage. And so if you have a question about anything, if you could put it in the chat, we will have a time at the end of the call to answer any questions. So I'm going to try to go through everything so that we can have time for people to ask questions and for you to gain any clarity if needed. So review of the bylaws. Let me pull those up for you. Okay. Can everybody see the bylaws? Thumbs up, Cynthia. Can you see them? Because you have your camera on. Alrighty, so the bylaws just goes through the name of the group, The authority that we have, the mission, um, the members. So we had voting members that represented DPBH. So that was myself and our state epidemiologist at the time. We now have an epi group. Lindsay, is that the name? I forgot the name of that group. Um,
The State Office of Epidemiology.
State Office of Epidemiology. So we will probably have our HAI representative from that group serve in the role of the state epidemiologist and just communicate any information that we need communicated to her through our representative, who is Cameron Jen. We also had representation from our QIO, which is Co-Imagine Health, from our local health authorities, which are Southern Nevada Health District, Washoe County Health Department, and Carson City Health and Human Services. And then, of course, representation from the healthcare personnel. One of the last representatives that we added was a pharmacy rep, which we never got to add one. We also have representation from skilled nursing, both north and south, acute care north and south, and then our laboratories north and south with the Nevada State Public Health Lab and Southern Nevada Public Health Lab. One of the, which we have to have an odd number of the voting members so we don't have a tie. So one suggestion is to add an ID doc because we never had representation from a physician on the group to help round things out. So that's another edit that will probably, well, that will be suggested from me, but that will be voted upon is to add an ID doctor because right now the voting members are an equal number, which won't work. Each member has to have a proxy. So their proxies have to be present at the meeting if they're unable to attend. And they also will obtain all of the voting power that that voting member has. They have to notify us within 24 hours if the voting member is not able to attend, so that we can be sure to be aware that the proxy is going to attend and have them represented when we do the quorum to make sure we meet the 50% plus one. So at the time when we developed the bylaws, the members were serving a term of 2 years or until the successors were appointed. So that's something you may maybe want to make it 1 year or keep it at 2. So everything on here, this is just a draft of what we had in the past, so we can change all of this. We did try to keep it as simple as possible. So I would like to maintain the simplicity of it if possible. But it just makes things easier to operate and navigate for our side. So staffing for like legal, secretarial, research needs were provided by the Division of Public and Behavioral Health. So that usually was our HAI staff. And then of course, if anyone needed to assist in anything, they were able to provide their assistance. And so for voting, the voting members, as I mentioned, have to be present at the meeting. If they miss 3 consecutive meetings, then they are no longer considered an active member. So we will send out notification and let them know, hey, you've missed a meeting or you've missed 2 meetings. You're on the verge of being removed as a voting member. And if they still didn't attend, then by the bylaws, they would be able to be removed, and then we vote to replace them with a new voting member that represents their area. Section F covers quorum. So as I mentioned, we have to have simple majority, which is 50% plus 1 present at any time. If we do not have 50% plus 1 present at the meeting, then we're unable to hold the meeting. Also things that can cancel a meeting if the agenda isn't posted. I believe it has to be like a month before the meeting. So if we don't get that posted in a timely manner, our agendas have to be approved. So if we don't get that approval on time, those are different things that can cancel a meeting that's been scheduled. It's just talking about the members. Officers, the duty of the officers. So normally nobody wanted to be the chairperson, so I serve as a chairperson, which is perfectly fine. And represent OFE. So that's one of the reasons why that was me, but that's, something that can change. The vice chairperson is somebody that's elected. The secretary, as I mentioned, usually is covered by our staff, but using the recording technology with Teams, it gives us a transcript. So that's something that's a lot easier now for us. We do have to hold regular meetings, at least once every 6 months. So I mentioned we used to have the meetings quarterly, unless we had a deadline or something with CDC. And then usually that was a subcommittee that would meet, and those would be more frequent meetings between the subcommittee, and then we would bring the topic or, whatever a document that we're working on to the group, and for the approval of the group and the voting members. We never had to hold a special meeting, but we do have that in here as well as for the voting and our annual meeting. It's just the last meeting of the calendar year, and it just gets the title of annual meeting. This is the wording for the open meeting requirements, and then language on the committees and amendments. So that is, these are our bylaws. So all of this is up for change and edit by the group once we identify who the voting members are going to be. Okay, can you guys see the agenda again? This is moving a lot faster than I thought. So just some upcoming HAI projects that we would need the input of the group. One project that we were working on, we tried to work on in the midst of COVID, and it just couldn't make it happen because of the surges that we would see in the pandemic. So working to get all of our facilities in line with the CDC core elements. So Jennifer Sanguinet, I'm not sure if she's on the call, but she developed a checklist based on the core elements for the different facility types. So there's acute care and skilled nursing. And we sent that survey out to all of the facilities to complete, to show where they were in compliance or out of compliance for the CDC core elements. For those facilities who were not in compliance, the HAI team or a group of AR experts will reach out to them and to identify gaps to help them come in compliance to the CDC core elements, so that our state, as a majority, would be in line with the CDC core elements for antimicrobial stewardship. Another part of that activity was to have a mentor-mentee program. So that if there was a skilled nursing that met all of the core elements, we would hopefully have them volunteer as a mentor and to assist other skilled nursing facilities throughout the state on how they overcame certain barriers of having like a physician lead, ID doc lead, some, certain things that aren't as easily accessible to them as an acute care hospital. I know we were utilizing Project Echo and some of the physicians that served in that program to serve as leads, but I do not think that's available anymore. So that is something that we will be picking back up and probably sending out that survey again to get a new, more up-to-date baseline of where we are with our facilities and CDC core elements, and then moving forward with that project. Also in the past, we utilized the Healthcare Effectiveness Data and Information Set, or HEDIS, which is one of the healthcare's most widely used performance improvement tools. So we utilize HEDIS to identify the top 10% antibiotic prescribers in the state. And we work with our chief medical officer to develop a letter that went out to these physicians to let them know that they were identified as a top prescriber. And we also provided education that CDC gave us in line with this project to educate on the dangers of the overuse of antibiotics. And then there were posters that CDC had made that we sent out for them to post in their doctor's office, because most of these were like your your family practitioners in outpatient settings versus inpatient and acute care hospitals. So they had posters that they would post saying that they would prescribe antibiotics appropriately. There was patient education so that to try to decrease the seeking of antibiotics from patients. Of course, we all know they see it as a cure-all, and it is not. It's not effective for viruses. So the posters also provided that education. So we will, of course, look at the providers that we reached out to before, but then also identify new top 10% and reach out to them as well. And then another project, of course, is that we always need to stay abreast of the best practices. So developing our webinars and statewide training. So I would like to at least host one webinar by the end of the year, if possible. I know the holidays are coming up, so that might be, a difficult task because we all like to and all need a break. But I am shooting for our statewide training to be hosted in the spring, just to get past the flu season and all of that, because this will be our first in-person training since the pandemic hit. So those are things that we will be working on, and that we need the assistance of this group, just to make sure that we are in line with CDC best practices, that we have the best resources. We working together makes everything better. Um, we have our resources with the state, but you all have the boots on the ground, the experience. I'm not a pharmacist, I'm not an infection preventionist. So I always lean on the expertise of you all, which is why this task force is so important, to help drive and make sure that we are meeting the education needs of the state, providing the appropriate resources that we need within our state. And then also we can tailor our grant activities to what we need in the state as well to get funding for those things. Um, so as I mentioned, I need the expertise of this group to know what's needed. So when we do put in our grant application, those are things that we can apply for. For instance, we partner with the Nevada Antimicrobial Stewardship Program, and we just completed a project of 6 trainings on different topics. So some of the core elements, we have outbreak reporting, and understanding what's reportable in the state, how to reach our outbreak team, um, utilizing case studies to drive education. I think they had antibiograms for one of the topics. And so the trainings are, I believe, about 30 minutes long. And then they also include nursing CUs and CMEs for physicians, their webinars, so you can watch them at any time. So that's one of the projects that we put in to have funded through our program, and we were able to pay for that training. So those are how it kind of works, where we understand what we need in the state and those things I can apply for in our grants through CDC, and then have the funding to make sure that we can complete those tasks. So next we will have Cynthia Hong, who is with Comagin Health, and she will provide a short presentation on some of the work that we're doing with their agency.
Hi, everyone. Are you able to hear me okay? Okay, perfect. Thanks, Kamisha. Yes. So my name is Cynthia Huang, and I am an improvement advisor at Comagin Health. So with me on this call includes Dr. Jean Lyon, who is our consultant in infection prevention and subject matter expert, and Kaylee, who is our associate improvement advisor. So for those of you who don't know who Comagin Health is, we are the QuinQIO, or the Quality Innovative Network Quality Improvement Organization for a 6-state region, which includes Nevada. So before we were Comagin Health, we were Health Insight, but even though we changed our name, we are still committed to serving the healthcare community here. And we are a neutral party, so our only agenda is your success. So I wanted to share our Nevada infection prevention initiative that we're doing here through the end of March of 2023. So we're funded by Kamisha's department, the Office of Public Health Investigations and Epidemiology's HAI team. And we're offering 3 buckets of infection prevention support to you and your team. So as I'm talking, my colleague Kaylee will be dropping some links into the chat box. But our goal from this project is to help you build a strong and sustainable infection prevention program for your care setting. We know it's been a really difficult past 3 years with COVID, and we're just really here to support you and your teams. So one of the supports that we're offering is our echo sessions. These happen twice a month on Wednesdays, and we provide an infection prevention flash talk, but we really urge participants to bring their challenges, not only for our subject matter experts like Dr. Lyon to work through, but for all of the participants to work through as well. We use the all teach, all learn model, which is about everyone learning from each other and sharing recommendations. Because it's really likely if you're experiencing a challenge in your facility, that someone else in that virtual space is also experienced or has experienced that challenge and can offer you some suggestions and recommendations to mitigate it. So we host sessions at 10 a.m. and 11:30 a.m. And then one of the other supports we're offering is free one-to-one coaching and consultation. So these are hosted with our infection prevention consultants and quality improvement specialists. And we work directly with your team to identify gaps in your infection prevention program, outline practical steps to implement changes, and we help you track and sustain your progress. So some of the themes that we can help you with are like if you're a new infection preventionist who's seeking some guidance on how to get started in your role, or if you're a group home and you're looking to build your infection prevention program. So if you are interested in this support, please reach out to us at our infection prevention advisor at comagine.org email, which Kaylee will drop into the chat box as well. And last but not least, we have our Project First Line SMS text campaign. So this support is really geared towards your frontline healthcare workers who might not have the time or the capacity to attend a webinar or a formal educational session. So we send out brief infection prevention tips pulled from the CDC's Project First Line on a weekly basis. And we do have posters and flyers available for you to post in your break rooms or hallways or wherever you think it'll best reach your frontline healthcare workers. And just so everyone knows, this support is completely free to you. Kaylee also dropped the link to Padlet, which is our learning library. So if you do happen to miss an echo session or you want to see what we've covered in the past, the recordings are all there along with the slides and the resources that we share. So if you do have any questions, please do not hesitate to reach out to myself, Kaylee, or Jean, and we would be happy to support you. And thank you so much, Kamisha, for giving us the time to share this support.
No problem at all. Thank you. So before we move on, are there any questions for Cynthia? Feel free to come off mute or put your question in the chat. Okay, well, I think you did a great job, Cynthia. There's no questions. So the items for Padlet and their email addresses are all in the chat for you to access. And we'll try to get those items to those who called in and get those emailed to you. One item that I did miss on the agenda is the CRS outbreak. So I did want to mention that while I have everybody on. Cynthia, can you see the memo? Uh-oh, turned your camera on.
Yeah.
Okay. So we do a monthly count. Our last memo went out on October 20th. So as of October 7th, we did our last count, we had 567 cases. The breakdown in those cases are 227 that are clinical, 340 that are colonized, in a total of 28 facilities. The breakdown of the facilities are 13 are acute care hospitals, 7 skilled nursing facilities, and 8 long-term acute care. And those have been reported to us. There have been 69 deaths of those deaths, 49 were in patients who were clinical, and 20 of those deaths were in colonized patients. So we do have a training on our website that is MDRO containment. So the training is through CDC, but it is on the state of Virginia's public health website. So I obtained permission from both of those parties to add that link. It is on our HAI page, which I will add the link to our HAI page in the chat box shortly. So there are about 6 trainings on there, and they're really good. The one that I really liked was how water contamination can lead to the spread of MDROs. So if things being stored by sinks, splashing of the water, if the sink is contaminated with CRAB or different organisms such as that, splashing on medical equipment that are stored by the sinks and then used on patients can be a source of infection. So I think they're about maybe an hour long, and they also contain, will offer CEUs. So you can watch them, of course, in your spare time, get that education, get your CEUs, but also be more equipped to help decrease the transmission of MDROs in your medical facility. Another thing that is on our website and that we've had great difficulty with is the communication between facilities. We receive, facilities work with us on screening and getting testing done, utilizing our state lab. But one of the frustrations that we hear a lot are that they're receiving patients that they are unaware of that have CRs until they do their own, screening when they admit the patient, and then they find out that way. So we do have the interfacility transfer form. So it is a requirement through NAC, I believe it's in 449, that facilities do have to communicate if they are transferring a patient that has a communicable disease. This information has to be readily available. So sometimes the issue is that they put the lab results in the patient file, which we know those can be very thick, and people don't always have the opportunity to go through all of that. So utilizing this transfer form, hopefully let me click on this and open it up. Just a moment. Okay. Cece, can you see the transfer form?
Yes.
Okay. So this is something that we developed a while back, I believe, with MVASP, to have a one pager where all of the information is readily available. So the name of the address that you're sending, what unit the patient was in, a phone number, the IP's name, so that the receiving IP, if there's any questions, they know who to contact. It also has is a patient on transmission-based precautions? Have they been diagnosed with sepsis? And then if they have any of these MDROs, we also added, of course, CRS on there and COVID-19 when those became a concern. So you can just click yes or no or mark in there. And I believe this is a fillable document. Different things that you can say the patient currently has. If they have a hemodialysis catheter, when it was inserted, if they're on any antibiotics, so that they don't, sometimes I know one of the concerns where facilities receive patients and they don't know the start date for the antibiotics. So instead of utilizing the appropriate stop date, they just kind of start it all over again, which is, an overexposure of antibiotics to that patient. So you can enter their antibiotic treatment here, vaccine information, and then the name and phone number of the person who completed the form. So this is something that you can adopt into your systems. I know some people have just utilized the fields and put it into their electronic reporting. We've also, talked to facilities about having the case managers, when they're coordinating the transfer of a patient, they can utilize this form and fill it out. But this is one of the issues that we've been having, and we need to readily communicate this information to facilities so that they know what the patient is coming with, to make sure they can appropriately isolate the patients. And then also there's the access for screening. So our state public health lab I'm trying to get back to my document. Oh, here we go. Our state public health lab in the north and the south. So the south has a courier that picks up after the courier for northern Nevada picks up. So if you miss a northern Nevada courier, you can utilize the courier for southern Nevada public health lab. All of those specimens are flown to our state public health lab in Reno. And I believe the turnaround time is about 24 hours. And they can test for more than CRs. We'll put their website in the chat. So anything, that they test for, you can send it up there for testing. They have a form online where you can request testing supplies. And then that information is not only communicated to the facility once the results are received through fax, they also send us a weekly report of everything that they tested out for the previous week. So I have the link for the transfer form, also the link for the MDRO containment trainings. We also have resources on our HAI website for enhanced barrier precautions. So our IPs work to put together a risk assessment that you can utilize for your patients to see if using enhanced barrier precautions is more appropriate than using the contact precautions. So of course, if there's any questions or concerns, you can contact us at outbreak@health.nv.gov. That's outbreak@health.nv.gov. That goes to the entire HAI team. That email is checked daily by our staff. The only time it's not checked on the weekends when we're off, but somebody will be able to get back to you speedily versus emailing a specific person and that person may or may not be in. Are there any questions regarding the CRS outbreak? You are a very quiet bunch. Ready? And I'll try to get that information. If it's not emailed out to you, I will get it in the chat box. I believe the chat stays active in Teams, so even if we put it in afterwards, you can still access it. So our next item is for future meeting dates. So I figure it will take us a while to compile all the information for the new contacts and get everything put together. So we're looking at having the next meeting in January. If I can get a couple of, like you can do a reaction, thumbs up and things. Does this time work for everybody? This is a time that we had in the past, Fridays at 10. And the meeting normally lasts an hour. I wasn't sure how long it was going to last since we haven't had a meeting in a while. But we want to utilize a time that's more feasible for you all so that you can attend and give your input to the group. I'm getting a lot of yeses in the chat box. So we will keep this time and then we will send the invite out, but more than likely it'll be in January. So that we can get the information compiled together, give people time to submit their nominees for voting members, whether you're nominating yourself or somebody else. And then also, if you're nominating somebody else, we also need that time to reach out to them and see if they would like to be a voting member and being a part of this group. So as I mentioned, like the holidays are coming up, so I figured that would give us enough time. So just keep an eye out for the next invite for January. My calendar just to give you kind of a time frame. So probably that second Friday of the month, unless people have qualms about Friday the 13th, then we can move it to the 20th. Just giving everybody time to get back from the holidays and get back adjusted to work, so that we can have our next meeting and hit the ground running for the new year. So that's everything that I had to present. Are there any questions, concerns, information that wasn't clear that you want me to clear up? We scheduled, like I said, this meeting for an hour and a half, but looks like we'll be done in an hour. So that's good. Everybody needs time back to their schedule.
Hi, Kamisha. This is Kathy Johnson. I might have missed this because I'm traveling, but how many voting members will be on this committee?
So I believe there will be 15 if we add the, with adding the ID doc. Any other questions?
Oh, but a lot of good stuff. Thank you for what you're doing.
No problem. Thank you all for attending. We, the last look I had, we had 84 attendees. So as I mentioned, this is the largest meeting that we've had. So technology wasn't all that bad because normally this meeting is held in person at our Northern Nevada office in Reno, and then our Southern Nevada office by the Water District. So utilizing Teams has really helped to have more participation for our meetings. We more than likely will go back to the in-person meetings next year, and just because I think that's one of the requirements for open meeting laws, that we have to have in-person locations. So if you are an in-person person, we will have that option available. Otherwise, we'll still join on Teams as well. Anybody else? Thanks, Christine. Alrighty, so please make sure you fill out the form with your updated information, facility name, so that we can update our distribution list and get that out to everybody. Keep an eye out for the invite for the next meeting in January, which I remember last time we did have people that were pretty particular about Friday the 13th, so I'll shoot for the 20th. And then also, if you want to be a voting member, put your information on the form. And then also make sure you put which capacity you like to serve in. So if you're at an acute care hospital, an IP, the local health authority. So just so we know how to categorize all of the potential voting members. And let me put my information. If you need to reach me, my direct email is kcausey. It's KCAUSEY at health.nv.gov. If you'd like to reach the HAI team, we can be reached at outbreak@health.nv.gov. That's outbreak@health.nv.gov. And I'll put that in the chat box as well. And then for those who called in, just when you get that text message, just be sure to reply so that we can get the information sent to you via email for the link. And then also for the transfer form and our HAI, the link to our HAI webpage. All righty, thank you, everybody. Have a great day. You have a lot of time added back to your schedule. And I just look forward to all the work that we'll do together. Thank you.
Thank you. Great job. Thanks, everyone.
Thank you.